One of the most common questions I get asked is, what is the difference between a sinus infection and just a normal allergy exacerbation? With allergies, those are typically classified by more of the irritating symptoms. The itchy eyes, the runny nose, usually clear runny nose, sneezing. You just feel like you want to scratch your skin off. With a sinus infection, what folks will notice is symptoms are a little bit more severe. Your nasal congestion's worse. You really can't breathe through your nose properly. You'll have some facial pain and pressure. That can come in the form of pressure in your forehead, cheeks, even your teeth. We oftentimes get patients that think they have a dental infection when in fact they've got a sinus infection involving these two cheek sinuses. Sometimes you can get pain in the back of your head, and that can be sinus related because there's a sinus way back there called a sphenoid sinus that can refer pain to the back of the head. Other features that are more specific for sinus infections are yucky discharge. You typically don't get that with allergies. Discharge with a sinus infection is usually green, yellow, really thick. And overall you just feel worse. Something else that can help folks differentiate between an allergy problem versus a sinus infection problem that requires antibiotics is you can try some over-the-counter remedies and see what helps. Medications that typically help allergies are antihistamines. Nasal sprays oftentimes help, Flonase and Astepro. If you're not sure whether or not you have a sinus infection or allergies, a good rule of thumb to follow is that if your symptoms last for a week or greater, come in and see a specialist, because at that point we really need to do some additional testing to figure out what we're dealing with.